Folks, thank you so much for joining me today. I'm glad you're here. I'm very happy to see that you're here, wanting to know more about the Alzheimer's disease. Now, folks, the medical industry has done a good job, a phenomenal job in establishing care protocols in the last 10-15 years. How do you go about caring for an individual with Alzheimer's disease in a nursing home setting, in a hospital setting, in an assisted living setting, in a home setting. We have focused so much on care. One of the things I see is, I commonly see is people, when they look at someone with Alzheimer's disease, they kind of feel sorry for them. Let me ask you this. If you have the disease, or if I have the disease, would we like someone to feel sorry for us? I don't want anyone feeling sorry for me if I have the disease. I would like someone to help me engage with my family members. When my family comes down to see me, when my loved ones come down to see me, I should be able to know their name. I should be able to know who they are. I should be able to know what is the relationship. I should be able to acknowledge them. I should be able to engage with them. Have a meaningful conversation. Have a functional conversation. Have a conversation that my family can enjoy me. I don't want them feeling sorry for me. I don't want anyone feeling sorry for me. When I have the disease, do I want to look good? Do I want to smell good? And be in a wheelchair, be in a jerry chair, be in a chair, so that when my family comes out to see me, they feel that I've been well taken care because I look good, I smell good, I'm clean? Or would I like the way I said, more than that? Would I want more than that? The neuroscientists, the physicians, the pharmaceutical industry are working very hard with what they have to find a cure for this disease. Until that happens, until we find cure for this disease, we need to find a way to rehab these people with Alzheimer's disease. Folks, 50 years ago, 40 years ago, when someone had stroke, when an individual had stroke, the chances of them going back home and being functional in the home setting, or in their professional setting, or in their vocational setting was almost close to zero. Today, medicine has made advancements. There are ways to control blood pressure, ways to control cholesterol, keep the blood flowing, try to minimize stroke. However, if one has stroke, through therapy, through physical therapy, through occupational therapy, through speech therapy, the individual is able to regain most of their functions, at least function at the highest level of independence in their home setting or in the professional setting. My question to you, why can't this happen with Alzheimer's disease? Folks, the same thing is true with multiple sclerosis and some of the white matter diseases, Parkinson's. People are able to live their lives and function in the community at their highest level of independence, capacity, potential. My question to you is, why can't this happen? Why can't we have the same level of impact with Alzheimer's disease? We cannot sit and just care for people with Alzheimer's disease until a medication is invented, discovered, until a cure is found. Caring is good, we need that, but we need to do more than caring. An individual with Alzheimer's disease They require our caring, they need our caring, but they need more than that. Providing care is no more the fashion. Providing just care is no more the norm. Providing just care should not be just the standard. The standard should be finding a way to enable these individuals with Alzheimer's disease be independent as possible within their setting. Can it be done? I think so. I really think so. I think it can be done. We have to try. We have to try. And how do you go about trying? And we've tried this in our clinical setting and we've had some very, very good results. How do you go about trying? Let me draw a parallel, okay? Daycare, in a daycare setting, when a child goes to daycare, usually the child is at daycare, during the pre-K stages or getting ready to go to kindergarten. What does the daycare provider do? Do they just care for the child, or do they get the child ready for kindergarten? They do caring and teaching side by side. If they only provide care, the child will never be able to be ready to transition to another stage, which is kindergarten. Why can't we as caregivers, we as clinicians, we as medical professionals, why can't we do the same thing, the very same thing in a nursing home setting, in an assisted living setting, in a home care setting? Folks, we gotta think big, we gotta think beyond, we gotta think large. Just caring is not gonna cut it anymore. Caring is good, we need to care, but we need to do more than that. We need to teach them, we need to educate them. Activities are good, but I'll tell you something, activities have to be purposeful and meaningful. We are very good with our activity program. We have them engage in an activity, we have them draw, we have them listen to music, we engage them in different fine motor activities, gross matter activities. Those are very good. We need that. However, how do you use those skills, those strengths, and transition them or use them or transfer those skills to basic ADL functions and cognitive functions? Folks, what I'm suggesting is we provide care, but we also have to introduce learning. We have to introduce learning. Folks, thanks so much for being with me, and we'll talk a little bit more in our next podcast.